Hi, so now we're going to start on the hands-on portion of the Edermastamp facial treatment. We're going to start by numbing our client with Zenza, which is a 5% topical. We're going to just coat the skin very nicely and leave her for 20 minutes to numb out prior to treatment. The skin has already been cleansed. However, after we numb her out, we're going to cleanse her again and sanitize the skin. Please refer to your manual regarding the treatment when it comes to any contraindications or indications for treatment. So what we're doing today is just a general microneedling treatment for anti-aging. If she had some scarring or some deeper lines, I'll tell you how to assist in those treatments while we're doing this treatment here. And right now I'm just putting on a light layer of numbing cream, and where she's going to sit with this on her face for 20 minutes. So just nice even coating. She's already been prepped. We use the Derma Roller Cleanser to remove all makeup. I don't like cleaning the skin with any kind of moisturizing cleanser or anything like this. I pretty much stick to the Derma Roller line of products because a lot of other cleansers leave moisturizing agents, etc. on the skin afterwards, and I want the skin to be clean from all debris and moisturizers before I do this treatment. So this is our microneedling setup. I have previously sanitized everything. I've wiped everything down with Virox. I cover the top of the machine with plastic. Some people can just use saran wrap. That's really convenient as well. Just for extra precaution, I like to put an XL wipe on top. I put my cord cover on. You change all of this for each and every treatment to make sure there's no cross-contamination. I have my bottle of 70% alcohol. I pretty much use a 70% alcohol for all the face skin treatments and for sanitization, largely because of the higher percentage of alcohol that evaporates too quickly. Any kind of chlorhexidine product can cause allergic response if you're breaking the skin, so I'm just sticking to a basic 70%. All of this has been previously sanitized. This is our syringe of hyaluronic acid that we're going to be using, our tip, which is a sterile product. Because these are audited medical devices, you get this label that you have in the back. If there was ever a kind of recall, because we are audited, they would contact you because you have this batch number. You can keep this and stick this sticker on your client's form if you so desired. When you're looking at this, this just means that it's only single use, that is a sterilized product, that we have the medical CE 0482 certification on it, meaning that it is, and there's the lot number and the reference number, so it is a medical quality tip. Very important when you're thinking about microneedling, because a lot of the needlings out there, they can write sterile on it, but if it's not actually a marked audited product, it's not really a sterile product. We have our mask that we're going to use on the client afterwards, for recovery. This does a variety of things. In it is hyaluronic acid, a small amount of vitamin E, and matrixyl, and it is a wonderful recovery mask. What it does is it allows the skin time to close and keeps it sort of in an air-free environment for 20 minutes to continue the hydration process and to just allow the skin to just relax before it's out into the environment. So when you're doing microneedling, one of the side effects you can have is because you've perforated the skin, you can end up having a stronger histamine response if you're come in contact with pollen and you already have previous allergies, etc. So if someone has more skin sensitivities and more prone to allergies, you can take something like a Reactin or something like this, antihistamine for beforehand, just to make sure that you don't have any allergic response to your environment after treatment. Here I have my box of hyaluronic acid ampules. Typically we're giving one or two of these to the client for home care for about 48 hours after treatment. You should only be using a nice pure hyaluronic product afterwards. You don't want to be putting anything on too aggressive because you can end up again with skin irritation, etc. For post care, we're always recommending the Derma Roller ACE. So we have a lot of product here that is typically recommended for takeaway as soon as they've had their treatment. Our cleanser doesn't have the same amount of emulsifiers as other products, so typically a person is walking away after treatment. They can also buy the masks for home care, but a couple of ampules to last them. If there's any residual product, like from the hyaluronic acid syringes, I'm going to send that home with them as well. And they take home a cleanser and a moisturizer, whatever's suitable for their skin afterwards. And that's what they use. The cleanser, of course, is good for their whole entire package of treatments. To start the machine, we're going to hit the button in the back. And it comes up as 100, but what the number that we wish is 150. That 150 represents how many strokes per second that the needles go in and out of the skin. So 150 insertions per second is incredibly fast. So why you always want it as fast as possible is so that the needles will actually clear the skin as we're moving it across the face, so there's no microfissures caused and no tearing of the skin. Also, to stop and turn the machine off and on, we have a foot switch, which we just hit down here, and that's going to turn the machine off and on. And that keeps me from having to touch my machine while I'm engaged in treatment, so there's a reduced chance of cross-contamination. So now she's been sitting for 20 minutes and she's quite numb. So I am going to wipe this numbing product off. I'm going to wash her face with the Derma Roller cleanser, and then I'm going to sanitize her skin with 70% alcohol. Now I'm going to take some 70% alcohol and I'm going to clean her skin to make sure it's as germ-free as possible. Make sure you clean it really nicely. It's a little fumy for the client, so just give her some air. Take the tip off your hyaluronic acid syringe and keep it in a place where you're going to reuse it, because it does act as a little cap later. If you have any hyaluronic acid left over, you'll be able to send it home with her for home care. Make sure that you suck some air in to the syringe and gently push it out so that you can allow the product to flow evenly onto the skin. I'm going to take my handpiece. I'm going to set it. I'm just going to show you the scale here. On the handpiece itself, there's 2 dots and a little nick here on the top, and that's where you adjust your depth of penetration. So on the forehead, we typically start. We're going to just remove it down to 0.3, which there's 0.5, and then each little notch is 0.1 millimeter. So I'm just going to go down to 0.3. down here, I'm going to deliver just one little drop of hyaluronic acid on her forehead. So I'm going to put the tip onto my handpiece. I'm just going to grab it right here by the end. And just insert it into the handpiece. Just screw it in gently till it reaches the bottom. You'll see a little reservoir on the side. That's if you were going to be doing PRP or had any really liquid that you want to infuse into the skin. You can always syringe it into the reservoir on the side of the tip. So we're going to set the machine at 0.3 and we're going to start the forehead at that. That's just a light infusion. I have my hyaluron drop here. Make sure the skin is pulled nice and tight and hit the foot switch to get your stamp engaged. We're just going to do a few swipes, a few circles, and then we're going to turn it off with our foot switch. And we're going to just look. I can already see a red pore. Basically, you're not looking for a lot of blood. These are atraumatic wounds, meaning no trauma, meaning very little blood. They're like a microscopic paper cut. They're like the perfect wound. These needles are ground to 360 degrees, almost to an infinite point or a semi-infinite point. And so it sort of pushes the cells apart. So there's very little trauma. What you're looking for is just literally like a red pore. So I'm pausing for a minute to see the skin's response, because sometimes it takes a little bit. And I'm going to go up to 0.4 and I'm going to engage the skin again, because she hasn't even really turned pink at that. It is kind of shallow. I find my happy point on these treatments is usually around 0.5 on the forehead. So even at 0.4, it's kind of low. And I'm just going to allow the skin to respond to that. And I'm going to go up to 0.5. There should never be a lot of blood when you're doing this treatment. However, if you happen to be going over a scar when you're doing a treatment, you will, because you're breaking down that misaligned collagen fibers, you're going to have a lot of bleeding then. That's the only time you should really see a whole lot of blood during these treatments. So I can see a few little spots on her skin. I'm just going to alcohol my hands here again. I always like to keep on keeping my hands clean during the whole treatment. I'm just going to add one more drop of hyaluronic acid. Keep the skin nice and tight and turn the handpiece on, and I'm going to continue my treatment. When you're doing the treatments, make sure that your tip is really, this, I can see quite a bit of pinpointing now. It doesn't look so much in the camera. In some cases, you almost have to take a magnifying, but it just looks like little red pores all throughout. You can see her turning nice and pink. When you're moving the handpiece, make sure that you're perpendicular to the skin. A lot of times people are sort of whipping it around and they're doing this motion. The needles then are going sort of up and down. They're not going into the skin properly. You should be using your arm more or less when you're doing the treatment, and not using so much wrist motion. So make sure that your needles are going in perpendicular to the tissue. And here you can see some little red spots. A lot of times when you're doing the treatment, because I'm actually blending it in with the hyaluron, you can hardly even notice it because it coagulates. Because it's such a perfect wound, it coagulates right away, so it doesn't bleed very long time either. So I have some redness there and I'm happy with that. And again, this is at 0.5. And one question everybody asks me is, how many passes do you do? I do enough passes until I'm sort of going by the coloration of the skin. I want everything nice and evenly pinked. That means probably about 3 or 4 passes, I'm thinking. But my circles are quite loose, and I'm covering a really nice area of treatment every time I do a pass. I don't like staying in one spot very much, because that feels like a sewing machine. It's very grindy. I like the skin to be able to have time to recover in between passes. I'm going to do on this side of the forehead now, as that side responds to the treatment. So I do not like segmenting the skin. I like to just keep everything nice and flowing, because it feels much more comfortable on the skin than if you're trying to concentrate the treatment in one area. And my passes are quite large. And you can see here, when I'm out of the area, you'll see more pinpointing. which is fine. Always keep the skin nice and tight. And I would be happy with that treatment. She's bleeding a little bit here and there. Whenever I do have a little bit of blood showing, and this is at 0.5, I just use the tip itself. You'd notice that I do not touch the skin that I perforated. I'm always sort of working out. I'm not spreading my hyaluron all over the place with my tip. That's just wasting my time and making it a tacky, messy area to work in. I'm literally bringing the hyaluronic acid with me as I work. So her forehead is finished. Right here, she has a little bit more blood, but it was a little vascular anomaly there, and it was right on the bone. So it's a little bit more, but that's nothing to be worried about. So I'm going to be doing now the pattern I like to do is I like to do around the crow's feet, the eye bags, the upper lip, and the chin area, because those are all quite shallow. So I'm just going to do a couple of drops of hyaluron here and there in those areas, just to sort of pre-soak it like this. So I just applied a few drops of hyaluron in the areas that I wanted to treat, and I am going to keep this cheek area nice and dry so that I can manipulate the skin. I'm not going to increase my level very much. I'm still at 0.5, which was on her, the same on her forehead, because I'm doing underneath the eye area and the tear trough area. This area here, a little bit of blood, I'm just going to blend it. I'm just going to go through here. And she's not pinpointing very much, so I'm just going to go up one level, 0.6. There was a couple of little areas here she treated with the freeze pen that I'm trying to avoid. I think that's what might have caused that, actually. And she's nice and red, so I'm done all the finer areas. I finished this all off at about 0.6. And when you stop, you'll see the pinpointing occurring here and there. Now I'm going to go up to about 0.8, and I'm going to start doing the cheek area. So I sort of like to work from my face in to out, because again, I don't like handling areas that I've perforated. So I'm going to hold her skin nice and tight so it feels nice and comfortable, and I'm going to work in circles up and down in a nice linear area. I'm going to go right underneath, and I'm going to go right up. I have to avoid those areas that she treated last week with the freeze pen. And you can see the area here where I just treated a few minutes ago is now pinpointing. Sometimes it takes a minute or two for it to respond. So I'm just doing circles up and down in a line, and I'm working my way out into the exterior of the face. I'm going to get nicely underneath her jawline there too. I have to avoid this area here because she did some freeze pen there earlier. Some cryotherapy, getting rid of some moles. Now out here is thicker. I'm going to go all the way out to 1 near the ear. I really like to treat here because as we age, you often see people with a lot of lines around their ear. And tightening this actually brings all the jawline out. It's actually a very important area to treat. So right now I'm sort of going over this line here a little bit more. So I'm sort of doing a little bit of touch up on her skin. And then I'm going to turn my foot switch off. She's pinpointing down here, and I'm just going to blend any keratinized plasma that she secreted in with her hyaluron, and she is good. So now I'm going to start on this side. I'm just going to add some hyaluron in the areas, that I'm planning and treating, and that's all the finer areas. A little bit here. I'm going to set my handpiece back to about a 0.6 because I did the forehead at 0.5. I'm going to hit my foot switch on, and I'm going to start doing my treatment. I'm going to do crow's feet. I'm pulling down so I can get quite close to the eye area here. That's a very important area to treat if you're wanting to do eye bags, etc. And getting right in here over the upper lip. Now she has micropigmentation on her lips, so you have to avoid those kind of things because your immune system can break down her pigmentation. Always keep the skin nice and tight when you're doing these treatments. You get better glide and better perforation on the skin. So I'm just going to continue to treat the area. And again, I'd like to bring to your attention that I do not massage or touch areas that I've perforated, because that's how you can end up with cross-contamination. And it's irritating as well for the clients. They don't want to feel that. So I'm pretty much done. Might do her bottom chin here at 0.7 a little bit, just to get, she has some fine lines here I want to address. And again, I'm doing very big circles back and forth. I don't like staying in one spot too fast or too much, because again, it's 150 insertions per second, and it feels like a sewing machine if you're staying in one area too much. So I'm just going to go like this and blend anything that she has in with her hyaluronic acid. I'm going to increase her depth like I did for the other side up to 0.8. You can see she's nicely pink everywhere. Every once in a while you'll have something like this, and that's just where she had a little vascular anomaly, so you're going to have a little bit more blood, and that's absolutely okay. She'll be fine soon enough. So I'm just going to do circles like this, up and down in a linear motion. I'm probably going to go about 4 passes. 1, this is 2. And I'm just going in big circles back and forth on the cheek. And I'm working my way out to the exterior of the face, slowly. And I'm always keeping the skin pulled nice and tight. And this way you have nice pull on the skin, and I never have to worry about cross-contamination because I'm not touching something that's perforated. Even if they're not producing blood, even if they don't show it, there's still plasma there, and I do not want to have that in my clinical setting. I want to have as little as possible of any chance of cross-contamination. I'm going to put a little bit more hyaluronic acid, and as with the other side, I went up to 1 millimeter along the side here because she wasn't pinpointing very much, and it's thicker tissue. So I'm going to go all the way up to 1. Most of the treatments are actually done quite shallow, and I'll tell you why. To the most part, when we're doing these treatments, they're anti-aging, and most of the damage is done on the papillary layer, not the reticular layer. Scarring and deeper wrinkles are in the reticular layer. So those types of treatments, of course, you'd have to do deeper. But to the most part, anything over 0.5 is in the papillary layer, where we have more UV damage, and you're going to have a nice result regardless. So don't have to worry about so much blood or anything. As you can see here, I have a little bit here and there, but that's about it. She wants her neck done, so the neck I'm going to keep at about the same depth, and I'm just going to put a couple of big drops there. I'm going to do her neck at about 0.8, and I'm just going to pull down tight, big circles. She has hemangioma there, so she might have a little bit of extra bleeding in those areas wherever there is any kind of vascular issues. And just big circles, just covering really nice. And I'm going to do this side now of her neck, pulling down nice and tight. She has a mole, got to avoid the mole. Now I'm going to turn this down. I'm going to do her nose. A lot of people don't necessarily need their nose done. If they don't, I just don't bother because, again, it's very vascular area. I'm just going to go over here. Normally it's done at about 0.3. I don't like having my nose done because I almost bruise almost all the time wherever my glasses sit. So I just as soon not have it done at times. But if someone wants it done or has large pores, etc., doing the nose can be very helpful. So I'm just going to do a little bit of hyaluron into the bunny lines. I'm pretty much done. That was a very easy treatment. I'm going to put her mask on. So I love this as a recovery mask. You can use this after trifractional resurfacing, or you can use this after any kind of aggressive treatment. A lot of people just like it even as after a soft treatment like the Oxygenale. I put my fingers like this and I pull it out because there's a lot of product in here. A lot of times I'm sending this liquid home with the client for aftercare because it's really hydrating. They can use this on their way home. Again, it's hyaluronic acid, matrixyl, and vitamin E. I'm going to open this up. And there's a blue layer, which is often discarded. I always like to use it. I'll even send it home sometimes with the client. I'll put it back in their envelope and they can use it as a home care later as soon as they get home because it's still full of serum. So I take the blue layer and I'm just going to use this right here on her neck that I just treated. I'm going to leave that just to cool it off. And I'm going to take her face mask with the plastic on it and I'm just going to lie it on the skin. Just like this. This is going to keep her skin nicely protected and air-free and hydrated for the next 20 minutes. And it's probably going to reduce the redness by, I would say, like anywhere between 50 to 70%, even 80% at times. It is really, really calming for the face. And they feel that calmness immediately. A lot of times, because it is so comforting for the skin, even though the skin's been so perforated, they sell them at a lot of different locations for home care because our ampules and other hyaluron products, they have maybe some alcohol in them to keep them to have less preservative, but that can sting on the skin. So the masks are a really nice alternative for someone that wants really nice home care without irritation, and it's sort of like an insurance policy. They don't have to worry about their skin getting inflamed when they get home by putting something else on it because this is so accepting to the skin. So you just keep like this, keep all the air bubbles out, keep her mask here nice and tight, and she's going to rest like this for 20 minutes. After the treatment is done, we're just going to remove the mask. You do not put any sunscreen on. You do not put on any finishing product. The skin's going to be quite dewy from the liquid from the mask. I just leave that on because her skin's been so perforated. She's going to have a tendency to be dry afterwards. So leaving the residual product on is just going to safeguard her skin on her way home. So it's going to absorb and it's going to feel much more comfortable. And when she gets home, then she can start putting her other hyaluron products on. So no sunscreen for at least 48 hours. When you do put sunscreen on, I like a powder or something that's not absorbent. Just don't play experiments with your face. If you don't have a proper home care, I always suggest the Dermaroller products because it really increases the results. And also I want a fresh product. I don't want them to be using something from home or something they got a few months ago that has a lot of bacteria in it because that's when you're going to end up with issues. So she's finished and she's going to relax here for 20 minutes, and that's the end of our treatment.